It's 1 o'clock and we're going to get started. Hi, I'm Debbie McCullough. I'm the Executive Director of the Michigan Library Association. I just want to welcome you. We have a few more that'll be joining us, and I think Rachel and we'll be opening up that waiting room and allowing everybody to come in at this point. But today I'm joined by Kendra Morgan, who is the Program Director at the OCLC for the REALM project, the Reopening Archives, Libraries, and Museums project. And we're really excited to be able to be here in Michigan and hear some of the test results and to know kind of what's coming up next and where we're heading. But it's clear that, you know, what the handling of library materials and archival materials and museum materials are really critical at this juncture with the global pandemic still on top of us. So I'm not sure that we're going to have all of the answers today, but you'll certainly be able to ask questions in the chat. I have a page and a half of notes that you sent in advance. So if everyone would please just make sure that your microphones are muted. Kendra's going to share her screen with us. We are recording this session. It will be available on the MLA Connect site in probably tomorrow or early next week. We're excited to be able to share this information with you. So before I begin, I just want to make sure that we give Kendra the proper introduction. Again, she's joining us today. She said this was about her 9th or 10th session around the country, but she is working with IMLS and Battelle, but as the program manager for the REALM project, and she's overseeing the project's research and the activities and the administration. Her primary responsibilities are delivering and the management of the WebJunctions, the core programming and the continuing education services for state and public libraries. So Kendra, we're very happy that you're joining us. We've given you permission to share your screen, but probably an introduction first would be in order. Yeah. So thanks.
Great.
Thanks.
Thanks, Debbie. I appreciate it. And thank you to all of you for joining us today. I am joining from my new home office in Seattle, Washington. Usually I'm in our physical office, and I can see that some of you have been able to return to your offices. And I really appreciate you taking some time to join us. I know you have lots of questions and are probably somewhat familiar with what's happening with the project at this point. But what I will do is go through a presentation and talk about how the project is structured and what we've been learning. And then I'll save 20-25 minutes at the end for some questions, because I know Debbie has received quite a few of them. So I'll make sure that we save lots of time to go through that. All right. Okay. So just as a quick note, you can find all of the project materials. Everything that we'll be referencing today is on the project website. We actually just launched a new site this morning. So that's just oc.lc/realm-project. We're really trying to be as transparent as possible about the materials as they become available. So we're sharing them out quickly and making sure that those are posted to the site. So Debbie already introduced me, but my name is Kendra Morgan, and most of my work is usually with public libraries with our WebJunction project. And WebJunction provides continuing education to library staff around the country, including in Michigan. It's a freely available service, and we do that with the support of state libraries. So if you're not familiar with WebJunction, it's a good thing to check out. We ask and work with library staff around the country on developing that content. And it aligns well with the work that we're doing with REALM, trying to help inform libraries and library staff around what's happening in terms of this research project. So there are 3 key organizations involved with the project. So we have our staff, our project funder at IMLS, and this project came directly out of conversations that the IMLS director, Crosby Kemper, had at the beginning of the pandemic, where there was a direct ask from both the library and museum community to better understand the impact of COVID-19 on libraries, and particularly library materials and museum materials, the things within our collections that people are touching. So they launched this project working with OCLC under a cooperative support agreement. So they are the funder, and they are both very involved in developing the project goals and activities, and they also convene steering committees and working groups that help support and provide input on the project activities. So we have an executive steering committee, and we also have a scientific working group and an operations working group to help inform decisions about the materials that are tested, the test dates that we're using, how we're interpreting the results and publishing those. So these are all individuals who are actively working in archives, libraries, and museums who are helping to inform the project. And then we have our colleagues at Battelle who are doing the actual research. So we provide them with materials and parameters for testing, and then they issue a report on those findings. And they're also doing literature reviews that are really in-depth on how things are changing in the COVID-19 landscape during the pandemic. And I'll talk more about the findings of those literature reviews and some that are upcoming. And then the staff at OCLC. So we are responsible for leading and managing the execution of the project deliverables and making sure that we're getting the information out there and publishing and distributing the research and then synthesizing stakeholder input to inform decisions. And so events like this, where we're participating and sharing the project results, are part of our the scope of the project that we designed in order to make sure that people receiving information about the project as well as getting input. So things like, opportunities like this for us help to inform activities going forward. We'll often take that back to the steering committee and working groups and implement some changes or meet requests from the field. So we have a couple of big buckets of activities that are happening. So reviewing and summarizing the authoritative research that's available. It will come as no surprise to you that this has been an unprecedented amount of research in the past 9 months around COVID and coronavirus in particular. This is throughout the world. It's not exclusive to us, obviously, but there's an intense amount of international research happening that's being published and being made available as people seek answers. We're looking for that ongoing engagement with subject matter experts from our respective communities. So really focusing on those archives, libraries, and museums. The lab testing of materials, so actually sending materials to the Battelle lab and performing tests. And then creating resources, which is we're diving pretty deep into this now at this phase of the project, and then sharing out those resources with the communities. So just to break down where we are in phases, this project launched in May, where we really put a focus on high priority materials and workflows that impacted public libraries in particular. We understood that this was going to be a pretty intense time for public libraries, and we're most likely to be on the looking to reopen, depending on, of course, the local requirements. And then in the phase 2 of the project, which we're currently in, we're looking to do additional research that looks as well at archives and museums, still keeping libraries in mind. And then October through September, we're building more toolkit resources during that time and continuing to monitor and update changes that may impact the respective groups. So just as a quick overview of where we are so far, we've published a total of 4 test results that came out between June 22nd and September 3rd. The 5th set of testing items will come out in October, and those are looking at a lot of textiles, including leather bookbinding. We test 5 items per set. So with each test, we get to choose 5 items, and I'll talk a little bit more about what the testing looks like when we get there. We also published a literature review, and that first literature review was really focused on, anything that might be relevant to public libraries. And as it turns out, it was really applicable to all types of organizations that serve the public, which is helpful to the project. And a second literature review is set to be published in mid-October. So that's where we are with the current research activities. This is a really, these known unknowns are something that we touch on with as often as we can, because it's really important when it comes to your own local decision making. And it's also shaping how we conduct the project and what information we're able to share. The first, and these are known unknowns for the entire world. Like, these are things that that are just not answerable at this point, which inevitably leads to a tremendous number of questions and sometimes a lot of uncertainty and ambiguity, which is really challenging to deal with. Like, we absolutely understand the challenges that are placed on organizations when it comes to reopening and setting up policies and procedures and deciding how long to do to quarantine materials, for example. But of these known unknowns, like, the first is that we don't know how many virus cells an infected person will leave on an object. So we can't tell you how many any one individual might leave behind. If you just take into account all the differences between children, adults, how close they were to an object, how far away, how many days, we don't know. We don't know how many they are shedding, for example, if you're coughing or sneezing and you're infected. We also don't know how many cells you can pick up from an object. So if you touch something, what's the likelihood of transfer? How many are you likely, to pick up and transfer? We don't know that information. And then of critical importance is that we don't know how many cells are needed to cause infection. And this is a really big unknown. And it's very challenging when thinking about moving through public spaces. So we don't know, certain strains of the flu, for example, can be infectious at 10 cells, can cause infection in another individual. Others are much higher, hundreds to 1,000. And that information just isn't available yet with this strain of coronavirus. So we'll dive into a little bit of the literature review and talk about what we were looking to understand. So the first was how the virus might spread through general public library operations, how long it might survive on surfaces. We talk a lot about environmental attenuation, which is how long it takes for the virus to die off naturally without intervention. And so for us, that often means quarantine, right? Putting items aside and not touching them. And how effective prevention and decontamination measures are that are available to public libraries in the near term. So this includes cleaning agents, disinfectants, personal protective equipment, PPE, face shields, things like that. So starting again, the literature review confirmed that the human infectious dose is still unknown, and there's a very wide range with similar types of coronavirus. SARS-CoV-2 is the strain that we're currently dealing with. SARS-CoV-1 was the original that was documented back in the 90s. Other areas that we know requires more exploration, and many of you are just familiar with this from local news stories, national, global news stories, but the idea of aerosolization and how that might be impacting the spread of the virus and transmission. So that's something else that people are still actively looking at and trying to better understand. And then environmental conditions. How much does humidity, temperature, ventilation or airflow affect the spread of SARS-CoV-2? We know that there was some early talk, for example, like in the spring when we were initially dealing with this, would we see a reduction in the summer months when things were hotter? Or is it more to do with the fact that we're outside more and access to fresh air? So there's people, scientists are still really digging into this. And like I said, this is absolutely a global issue that people are better trying to understand. So the PPE aspect of it, these are the low-cost options for reducing the presence. Cleaning surfaces often, so hard surfaces that can be disinfected The Environmental Protection Agency, the EPA, has come out with lists of materials that can help to kill coronavirus. Practicing social distancing, which is, just making sure we don't get too close to other individuals in public spaces. Washing our hands frequently. I'm still can't quite break myself of the habit of touching my face. And then wearing personal protective equipment. So our masks, our shields, to help reduce the spread. And those are all things that have been shown to reduce the spread. Other things that need more study and haven't received as much attention in the global research sphere, how much heat treatment may happen. So one of the examples that we get a lot with libraries is people asking if they can use a bed bug zapper, which many of you may be familiar with, that libraries have used. It produces extreme heat, and will that kill the presence of coronavirus? It does seem to be susceptible to heat, but the exact temperatures, the range of conditions, whether or not it would get all the way to the inside of a book, those things aren't yet understood, but they do know, the research does show now, that survivability is impacted with increased heat. Sunlight and other light-based treatments. So again, in the library sphere, we get a lot of questions about UV. Ultraviolet light is that one option, and we know that there are several machines on the market that have been promoted. Ultraviolet light does seem to have a positive impact in decreasing survivability. The big question is whether or not that's safe for our library materials or our museum colleagues to use on cultural artifacts, because it does have a damaging effect over time. So that needs more understanding. Our ventilation systems, so how HVAC systems may be impacting the spread and survivability, and then how much open space. So these were things that were all identified in the literature review. And our second literature review, which comes out in October, is looking into even more of these, like what's happened in the 5 months since the first literature review was published. What else can we learn? What else can we share that's going to be particularly relevant to libraries? So I'll dig in a little bit to the lab testing. So this is just a little bit of a rundown of how the lab testing process works. So this is again being conducted at Battelle using some standard temperatures, so 68 to 72 degrees and 30 to 50% of relative humidity. And one of the first things that we saw come up was people asking about, like we're in the Southwest where it's quite a bit hotter and drier. Would that have an impact? We're in a cold climate in the north and have a deep winter. What effect might that have? And so that's something that we are considering, and the project's scientific working group are looking at. Is that a test that we want to run? But with each round of testing, we get to choose 5 items to test, and they all have to be tested at the same environmental condition, which is a really important factor. We can't change it, like do 3 at a high temperature and 2 at a low temperature. They're all conducted in the same chamber and tested that way. The researchers at Battelle work in a biosafety level 3 containment lab to help keep their staff safe. You can see the gentleman there on the right. He's in one of their containment facilities, and they apply the virus to the materials using a synthetic saliva, so a fake spit. And these are all live virus capable of causing infection. And then they store those materials in the testing in either a stacked or unstacked configuration. And I was noting to Debbie before we started, we did our first test as a stacked material, and on test 4 we did, or unstacked rather, and then test 4 we ran it as stacked. And as it turned out, when we were looking into this research, stacking materials or understanding what happens when things come into contact with another one is something that just wasn't happening in the research world. and is relatively unique to this project insofar as we can tell in the published literature. It wasn't something that was conducted. Most of the researchers apply the material, the viral material, to whatever they want to test, and then it's exposed in the test chamber, and then they come back and test it. And as we explored options to talk about that, Battelle was like, that would be a good test. And we actually did that stacked configuration and really did see an increase in the longevity of the virus in those stacked configurations. And I'll show a little chart about that in a bit. And then what the Battelle, so once they apply the viral material to the items that are being tested, we get to pick a total of 4 time points to test and see how long the virus is surviving. And those time points are selected before the test begins. So using research that was uncovered in the literature review, talking with the scientific working group that's informing the project, talking with the Battelle scientists, we have to pick 4 times. They prepare all the materials in advance, and we're really looking to try and get to what we'll call the level of detection, that the Battelle researchers are no longer able to find live virus. And we're not always getting to that point. So they do measure the quantity of virus, viable virus, at those 4 time points and capture that data. So the materials are all cut up, and you can see that picture in the right-hand side. The researchers cut the materials into rectangular coupons and apply the synthetic saliva that contains the virus. They'll look at it at each time point and measure it to see how much virus. So we are applying roughly in the neighborhood of 100,000 virus particles per drop in the test. So that's what goes into each drop, and then they're looking, so they run a test to determine how much virus is still there at each time point. There's a massive drop in just an hour. So once the material dries, and as you look through the charts and the research that's published on the website, you'll see that there's a really big drop just by letting the virus die. Like, a lot of times it can be up to half of the virus is already gone after an hour. And then each time point, we usually see a pretty big drop. So the first thing that they're looking at is getting it to below or the limit of quantitation. And this is what they can use their machines to do. So they process the test material, and the machines come up with the total number of virus that are available. Once it's below the level of quantitation, the virus needs to be detected using a microscope manually. So the researchers actually put the piece of material under the microscope, they look, and they're looking to assign, like, there's 1 or 2 particles. So once it's below the limit of quantitation, that is a human manual entry. Everything above it is done using, I don't even know, like, microscope is a form of technology as well, but they use special machinery to actually do it when it's above the level of quantitation. And then I mentioned that we're always looking to try and get below the limit of detection, so nothing can be seen. And again, and these are cells that are capable of causing infection, but it may be very few. So it may be 2 or 4 in that drop when we started off at 100,000. So there's a very significant drop. And we're always able to get, I think with all the materials, we've gotten to below the limit of quantitation, but not always to the limit of detection. So this was the tests and the difference that we saw with 4 items in the stacked configuration. So in an unstacked configuration, a DVD case, a soft cover book, hardcover book, and a plastic protective cover, below the limit of detection when we got to 3 days. 3 of them were at 1 day. Once we stacked things, and this was pretty straightforward in that we just stacked like to like materials, we still weren't able to get below the limit of detection for those items. So it really did make a difference. The number of cells in most cases was, below the limit of quantitation. So again, they're looking at it through a microscope. It's very few, but they're still there. And that's what we're reporting in the research. So talk a little bit about sharing the results of the project. We are trying to be really open with all of the research that we're conducting. We're putting it onto both the project website and into OCLC's research. We want to make this publicly available to other researchers who are looking to use the data. So the data sets and all of that information is being publicly shared. If you've used WorldCat, you'll actually find an entry for the Realm project there, connecting folks to all of the research that's being published. And we're finding that even this is not as typical in the research world. We're trying to make things available again as quickly as we can and sharing them. And that's not always the transparency that we've been trying to achieve with this project isn't always the case. Even in talking to folks, they're like, well, we're conducting a study, but we're not ready to publish yet. And of course, a lot of those people are going to a peer-reviewed process, which this is not. In order for us to do a peer-reviewed process, we'd have to complete all of the research and then submit that for peer review. We're considering that for the future, but in the interest of getting information out, we are not doing a peer review process. So looking ahead to what's coming soon, the test 5 results will be out in mid-October along with that phase 2 literature review, the new project website that I referenced, toolkit resources. And when we think about toolkits, these may be a really range of videos explaining how illustrative examples from libraries around how they're choosing to use the Realm information, how their local decision-making process is going, documenting the known unknowns. We know that for many of you, a huge part of this is, talking with your staff about decision-making, with your boards, with your local authorities, health authorities, government. There's a lot. And one of the feedbacks that we've received is that, being able to take the Realm reports to the health department as they talk about, what should our library procedures look like? It's just a talking point to say that this is what we understand a little bit about libraries. And what we hear is, sometimes the health departments are like, great, this is helpful. And this is where we think how to inform the policies and procedures that you have. So people are using it in those ways, and we're capturing that as part of the toolkit resources to help others in that decision-making process. And then, of course, the continued community discussion that we're having. So I expect that many of you today will have some suggestions that I'll be able to take back, as well as helping to inform, like I work with our toolkit editors on the resources that are being developed and how do we position those in a way that helps with decision making and that helps inform those conversations that you all need to have locally. So we have a session coming up on October 8th on collections and facilities, and this is caring for your resources. So during COVID-19, and we're going to be joined by 2 staff members, one from the Northeast Document Conservation Center, the NEDCC. So Bex will be joining us and talking about how they are using Realm information to inform their policies and procedures. She'll talk a little bit about how the NEDCC thinking on things like ultraviolet light in terms of caring for collections and what you should know. And they've also been updating leaflets with each release of the Realm data on informing steps that they might want to take. And again, these are all resources that you can use in helping to interpret and make your own local decisions. And then we'll also hear from Karen from the Children's Museum of Indianapolis and how they're approaching their space and their facilities and what that means for them as they welcome visitors back into their museum. And when we think about caring for your resources, a big part of that for us and the work that I do with WebJunction is acknowledging that our staff are one of our resources. Like they're one of the library's most powerful and strongest resources, and understanding and acknowledging that this is an extremely stressful time filled with ambiguity and challenges, which can be so difficult to navigate, and that everyone is truly doing their best. It's something that, we certainly see surfacing in the questions that we receive, where people are so curious about, how to handle a very specific situation. And everybody wants to do the right thing by their community and by their staff, and to also take care of themselves. And so we'll talk a little bit about just acknowledging the stresses that this puts on everybody as we seek to move through this time. All right, I'm gonna stop the screen sharing so that we can I can see everybody. All right.
So Kendra, we had all of the participants that signed up for this send in questions in advance, and I encourage you all, if you have questions after Kendra's presentation, if you want to type those into the chat box, we will try to get to as many of them specifically as possible. She says she has heard all of your questions before and she probably hasn't answered, but maybe we'll stump her this time. So, but I want to start with one of the first questions that actually came in from one of our co-op directors. It came from one of her libraries, was about the recommendation for cleaning rather than quarantining. And so I want to go back to maybe the slide that you talked about, the impact, the survivability on with the heat treatments and the sunlight and the other ultraviolet lights and ventilation systems and open spaces. Is there any recommendation or any kind of study or research that's going to happen on those that you will be helping with or being a part of at all?
So we currently have within the scope to do a total of 10 tests. So we've got 5 completed, a 6th one lined up, so 4 more to go. And we know that those environmental conditions are of particular interest, and it's something that the scientific working group and the project and the operations working group as well are considering. So it's definitely up there. The question that also I can see in the chat is around, heat on the virus. Is it going to be in the October review? And there is more in that. I just saw the first draft. So it is addressed a little bit more. And it's one of the environmental factors that we're looking to see if we can test. What becomes challenging is, if you want to test something at 120 degrees, that's a lot of heat. When you think about book bindings, if you're using glue, DVD cases, all of those. So trying to take into account what would be practical in terms of impact to materials. And that's an important consideration from a library perspective. I would say some of our more popular materials may be thought of as a little bit more expendable. And you'd be willing to subject them to different conditions more than cultural collections that you need to treat with caution. We know that UV light can be damaging to things like plastics, let alone our own skin, being out in the sun and things like that. So there are considerations there that Caswell will touch on with any DCC in that caring for collections, but it's definitely being considered as a possible variable, because it might be something people can control, right? Like putting it in a heat box or something like that.
Right. Well, we encourage everybody. I know that in the chat we had a registration link to that October 8th webinar. So we encourage everybody to go to that. But I think the other thing is that I think what your conversation today has been, there is just so much that we do not know, and the scientists don't know, and it hasn't been tested, and we still have such big question marks. But could you talk a little bit more about, you talked a little bit about the subject matter specialists and your scientific work groups. One of the other questions that came in are, are we able to share these results with, the epidemiologists, and can they make conclusions and recommendations for us? As we talked about before everybody got in the room, we want to make recommendations. We want to use science as our recommendation, and we're struggling with who should we who are these people that are a part of your study, and how much can we, how much are they going to affect what others in our state will be, who we're talking to, how much can we expect them to then share their contribution to your study?
Yeah. So the project, you can see all the members of both the working group, the scientific working group, the operations working group, and the steering committee, all the members and the organizations that they represent. So we have people from the Smithsonian, for example, from the National Park Service, talking about all of their facilities, individual museums, individual libraries, library systems. So there's quite a bit of representation. Urban Libraries Council, American Library Association. So there's a lot of representation in terms of are we, within the scope of the project, are we doing the right things, and are we looking at the right types of objects to test? In terms of what we can recommend, we really can't do that under the scope of the agreement. And this is, with IMLS as the funder, as a federal agency, they can't make those recommendations. So that is outside the scope. But what we are absolutely hearing is people having these conversations with individuals, like taking the information and going to your health department, talking to the state and saying, so this is the level of virus that we're seeing. Is this something that, at what level do we need to be concerned? Or how would you help us inform our policies? Because they're more in line and able to help inform that. There's also the variables that we're dealing with are pretty considerable. One of the things that I encourage people to think about is that this is not, there's never going to be a one-size-fits-all package. Just in terms of how different our smallest libraries in this country might serve a community of 250 people, all the way up to large metropolitan areas. You may be in a community that really is not seeing any infections, very low rates, and that could absolutely inform how your library chooses to address an issue of material quarantine. So I would really consider your own local situation, and you may have a phased approach to that. We do know that there is much more information published and available that, close proximity to people, it's the spaces that are of primary concern. What they can't say is if transfer from one object to an individual, what the risk is there. And again, this is global research. The CDC has published some information saying that they can't rule it out at this point. It's still up for consideration, but how we think about interacting with the public, using our spaces, should also be part of that conversation, and thinking about your community and how things are where you are. So in Seattle, we're in phase 2. I'm still, not supposed to be meeting with more than 5 people outside my household on a given week, and still can't go into the office. And so combining that, like our local library comes up with rules around curbside pickup, and using whatever local input and guidance you have in terms of the restrictions or safety precautions that are being put in place.
Do you think after after all of your results, the 10 studies are done, and I only thought there were 6, so that was news, the 10. So maybe you can give us a clue as to what's next. But do you think there'll be any conclusive results or recommendations by like ALA or somebody that would step up and say this is what our recommendations are?
I think most of those organizations are also collecting feedback from locals to find out how are people addressing it, to show illustrative examples because of the differences that exist, and not wanting to dictate or to put people in it could be to a detriment to have one type of policy shared by an organization. I think some people are doing it, and you know, I think it's fantastic if it fits within the scope of their organizational responsibilities to do that. And I know people are desperate for it. I know that the more examples that we can share, the better it is. And I know that the library community has been really supportive of each other in sharing out, this is how we're doing it and this is how we're approaching it. And that only helps to really give other people ideas for how they want to proceed. In terms of what's coming next, we do not plan out each test in a detailed manner. We have like rough ideas, and we've collected a compilation of materials in libraries and museums and archives that are of interest to be tested. But we don't plan it out because we're always looking for how the results may impact others. So once we get the results, and how would this inform choosing another set? Like if we don't have anything planned, for example, for test 7, 8, or 9, like are we going to change the environmental conditions, and then which items would we go back and test? So we truly use each test to inform the next round.
Great. So we had someone actually asked if the study used a heavy load of the virus. Well, I don't know what a heavy load is,
Yeah.
but was it a normal load, or was it a heavy load, or so?
Yeah, it is. So that's part of the known unknowns, right? How much virus can someone shed? It's a pretty heavy concentration, but we don't know exactly how much someone can give off. And if you think about the challenges around capturing that data, it's not simple, right? You take someone who's ill, you have to get them into a BSL lab and have them cough or sneeze. So there's a lot of challenges around capturing that information, and that's certainly a little bit beyond our scope here, but we are looking to see how often that is, or if that's being published and if that's being captured in the scientific research. It is a pretty, the researchers do think it's a pretty heavy concentration. They do know that someone, and I believe I'm saying this correctly, like a sneeze from someone with the flu has been known to capture up to 300,000 particles, virus particles. That I'm not positive I have the right number, but so we're right around 100,000 particles in that drop, which is a really heavy concentration, right? And it's in a single drop, whereas if this is part of the problem with this project, is things can get a little gross sometimes. But if I sneeze and don't cover my mouth, how much of it goes right onto the book that's next to me? Or, you know, that there are all these variables that can be really difficult to assess. But it is a pretty heavy concentration of approximately 100,000 virus particles.
I think there has been a lot of comparison, and one of the other questions were, well, you know, our grocery stores, you know, you pick up a hunk of cheese and you put it back because that's not the kind you want. Yeah. So are there comparisons being made between library materials being loaned and returned and loaned and returned comparatively to retail, and how do we compare to retail?
Yeah, that was one of when we wrote the project proposal, we really expected there to be even more findings that would be applicable from operations of other organizations, and groceries were one of them, travel, you know, use of spaces, and there hasn't been as much that surfaced. I need to dig in even more to like I said, I just received the first draft of the literature review, and need to be looking to see what else they may have found. The vast majority of information that's been published often relates to healthcare facilities, which are dealing with really unique situations to begin with. Like they already have somewhat stronger and more stringent cleaning procedures than most of our public buildings do. So it's a little bit different, but we were expecting to find more in the first literature review than we did. So I'll be interested to see what comes out of the second one.
Okay. So maybe some very specific questions. A colleague has a concern about opening the books to check in and then being exposed to the virus. Can you talk about kind of the interior of the book? I know that you did some testing on the interiors too. I think a lot of our colleagues, and I'll I know Kathy Lester just commented in the chat about, there are some very real fears from librarians and patrons alike, but from the library field itself.
Yeah.
And I think we just want to be reassured that we're doing the right kinds of things.
Mm-hmm. So I would say following those general recommendations around PPE, right, that we're becoming so accustomed to. I've even seen a few of you with your masks on in your workplaces now. We don't know what will happen. I mentioned that part of the test is applying the virus via synthetic saliva, and that takes about an hour for the droplet to dry, which is, it's a pretty short time period. And then there's a considerable amount of attenuation. So the virus dies off pretty steeply just with an hour of drying time. What we don't know is if you open something, like I would say something that was spore related, or, like if I have a flower, like a lily flower, the pollen that comes off of that, I could knock that, right? And the little pollen cells fall down, little pieces of pollen. I've got it all over my desk. We don't know if that's the case with coronavirus. And truthfully, that I don't know if that's being researched. Like, does something, after it's dried, come up in the air? The questions that are most prevalent right now are around, like the air droplets, right? When we're talking, when we're singing, when we're speaking, we naturally emit droplets, and if that has any kind of an impact, is something that's been of massive research, right, of interest. Like how are we spreading this? I don't know how much people have been looking at that research around opening something which is more than likely to be dried by the time a staff member gets it out of the book drop. The patrons dropped it off. There's usually more than an hour that's gone by. But I don't know if anyone is really looking at the dusting up, for lack of a better word, of a virus, or if that's even possible. I do not know.
So go back to your literature review, and can you tell us a little bit more of what's coming, since you've seen a draft?
Yeah.
What we can expect to see in that second literature review?
I can tell you it's very long. It's about 42 pages. So what we found when we first drafted the project and made the focus of phase 1 literature review on public libraries, because of the imminence that we knew was going to be felt, even more so than academic libraries or special libraries that could close their facilities, there was going to be an increased demand on public libraries to open and provide services. So we tailored that first literature review to really look at how would this impact public libraries. It will not surprise you to find out that there really wasn't anything published that was, this is how libraries are doing things. Like, the vast majority of what is out there right now is on common building operation materials, glass, metal, looking at things like that, or transactional. So people have looked at money, they've looked at paper, similar to the books that we have tested. And then a ton on the healthcare industry, right? So how is it impacting spaces in our healthcare as we seek to keep treating people who are infected and are coming into our healthcare facilities? So when we got the results back from the first literature review, we found that it was really applicable across all types of spaces, museums, there wasn't anything special. And then when we went to formulate the questions for the second literature review, the working groups and the steering committee all agreed that the gap analysis, like what has changed since we asked those first questions, are of most importance. And remember, those are, how long do things take to naturally attenuate? How likely is transfer, and what types of mitigation, heat, UV, things like that, how might those help? So those are all part of the second literature review. And I would say one of the part that's been, it's difficult to make an apples to apples comparison with some of the other research that's happening in terms of other organizations testing longevity and attenuation of materials, because people use different testing methods. So we are, again, looking at live virus that is capable of causing infection all the way through to the end, right? They can see a cell and they're like, that cell, if it came into contact, would be able to cause infection. The level, and this is, again, I want to reiterate, just because we found a cell that is capable of causing infection doesn't mean it will, because it has to have all the right situations, and we don't know what those parameters are. But the literature review definitely digs into a little bit more of the cleaning aspect too, like some of the research that's been published on cleaning materials for public spaces and medical spaces is a little bit more of a dig into that information, and then a little bit more on different types of materials that have been tested.
I'm going to go to one of the questions in the chat from, I'll assume it might be Julianne. On the realm test result data, the level of virus is presented as log reduction. Is it possible to translate that into a more pragmatic unit of measure, such as percentage, that is easier to understand?
Mm-hmm. Yeah, I've had to have a crash course in biology in the past 4 months, and it's a lot to take in. So that is actually a great question, and something that we are working on, fully releasing the data. So the other thing that happens is when the researchers look every day, there are 5 coupons that they look at for test items that they've looked at. And sometimes, like, especially when you get down to the bottom, like we're below the limit of quantitation, so we need to look at it with the microscope. Only 2 of 5 of the coupons, for example, may show virus. And what we're going to do is release all of that data so you can see how common it was. Because right now we're giving you a number based on an average across the 5. What we're going to release is the raw data that shows, how many of the 5 showed the presence of virus, those actual numbers, and those will all be released as spreadsheets to help other researchers who might want to dig into the data, as well as it provides a slightly more approachable way to look at it. And our toolkit editors are trying to do that as well, is interpret the data for a more a layperson audience.
So test 5 includes what right now? So, and it's in testing right this minute.
It is. We just got the first draft of the test data, and so that included let's see if I can remember all of them. Leather bookbinding, which has been on the wish list for quite some time. That was an item like circa 1860 that was provided by private donation. Our researchers at Battelle think it might be one of the oldest items that they've tested. So we've got leather bookbinding, synthetic leather. So expanded, which is the technical name for it, technical name is expanded polyvinyl chloride, expanded PVC. So a lot of used in furnishings to cover in our public spaces. Nice thing about that, right, is that you can often wipe it down. I've also been doing a deep dive into every release that we have. I become a little bit more familiar with different items. Polyolefin fabric, which is really common in public spaces. It has high durability. So if you've ever had to buy upholstered materials for a library, you generally, in most cases, like a large public library, they wouldn't be able to go to a local manufacturer like IKEA, right? Like, or buy something. They're buying highly durable, double, the stuff we tested was safe up to, or durable up to 250,000 double rubs. So it's a high traffic material. 100% cotton, which gets used in a lot of different ways, right? Sometimes in upholstery, children's toys and costumes that get used. So that's the 4th one. And come on, will I get to the 5th one? I'm gonna have to think about it for a minute, but it's another fabric.
Okay. So
I'm gonna think about it.
Can you, and as you think about that, or at midnight tonight, will you just give me a text,
Yeah.
right? Let me know what that fifth one is, or I can look on the website, I'm sure. But can you, just going back a little bit about um, the surface is being, about the surface is being sanitized and not, again, not testing. You obviously haven't gone through that process, but I think we have a lot of questions still about that. Obviously no recommendation coming through from OCLC, and trying to figure out what's happening within the state right now. But just how that virus, let me read this, is the Realm Project testing whether the virus exists or whether it is viable enough to infect someone. So maybe just the differences between those two things.
Yep. So some types of biological testing look for the presence of the viral cells, like even after it's destroyed, like, oh, we found bits of coronavirus, but it's not capable of causing infection. The tests that we're doing, the cell is capable of causing infection. The big question is how, is that the one, it has to get from the book to an individual, right? Like that's huge. And is that even possible? So when an object is infected, how likely can I touch it and then rub my nose? Would that cause infection? If it was one, and it, like, the number of possibilities, like the permutations and are really incredible, right? Like I have to touch it in just the right spot. I have to, it wouldn't come off between me putting my hands in my pockets, right? Like we don't know any of that, but what we do know is that the cell that they find is capable of causing infection. So it is viable.
So we've anywhere between 72 hours and 7 days. We have many of the organizations have, and I know all of the libraries are adopting pretty much their own version of anywhere between that. But do you have? I'll put you on the spot. What's your take?
Yeah. I appreciate the challenge of it all. And again, it's like it comes down to what's happening in your community. And you can absolutely take these results to a local health department and say, this is what we're seeing. How would you help us to inform that? It's this many cells, and they may say, like, we've heard lots of people who are like, and great, really productive conversation. Like I took this to my local health department and they said our current quarantine time of 72 hours is more than sufficient. Or our local health department said 24 hours will be fine. And then you're trying to make the best local decision, right? And using local people who understand your community and understand your resources is really the best way to go. And the other item is nylon webbing from a stanchion.
Okay.
I forgot that.
When before the conversation, we were just talking too about, whether and going back to, trying to figure out what your recommendation is, but just going back to our original conversation about if the virus is really strong in your community at the moment, you might have a different recommendation then. So, and our state is so big, and so, there's so many different kinds of areas, and I think that those local recommendations and things happen in different areas at different times. So
it's like at King County, where I live, they have different requirements for what it takes to move into the next phase, right? And I imagine that there are libraries that are tying what they do to those phases. Like our library right now, as far as I could tell, like the only restriction is that they can only do curbside pickup in phase 2, but how that happens and how that operates, I think it's up to the library to decide, but the government has said that at this point, curbside pickup is an allowable activity for the library. And it's going to be so different, for everyone. And then what needs to happen in order for you to be interested in changing those policies and procedures? One of the things about this is that we're depending on science, and science changes. We learn more, we evolve, we change based on what we learn. And sometimes it's information that makes it easier to make decisions, and other times it doesn't help. It's just like you have information to inform, but it's not a slam dunk. So it's really a matter of trying to factor those things in based on those local conditions.
Yeah, and again, I'll just reiterate, just there is so much we still do not know.
Mm-hmm.
And we are still finding information. Our science is still being conducted.
Mm-hmm.
And so I think that it's just a reminder to all of our libraries to, be watchful, to be on top of this, and to be, being a part of these kinds of presentations. Tomorrow it could change. So, we want to make sure that everybody hears it straight out of the source. And that, and I know that, some of your national webinars have been just so huge, over 1,000 people at some of them. So, so we wanted to give everybody here in Michigan just a little opportunity to hear from you directly. But if there's, I think that if there's any other questions, I think I could pass those along to Kendra after the webinar. But it's right at 2 o'clock, and we said we would be with you for an hour. So just a reminder, we have recorded this. It will be up on the MLA Connect site soon. And we're just very thankful that you could all join us. And I want to thank Kendra for joining us. And I hope that we can also thank Mercy, who is her assistant, who helped set all of this up. So thank you very much for joining us, Kendra.
Thank you all. I appreciate it.
Thank you very much. I thought it went really well.
You're welcome. You're welcome. I know there's there'll be endless questions, but if we can get a few answered, I'm happy to do that.
I'll send you over. If we get anything else, we'll definitely send them over to you. Okay.
Thanks, Debbie. All right. Take care.
Bye-bye.